Hello, my name is Mariel Borowitz, and I'm talking today about examining the role of satellite data in halting the transmission of polio in Nigeria, a socioeconomic analysis. And this is work that I completed with two colleagues, Janet Zhou from the Bill and Melinda Gates Foundation and Krystal Azelton from the Secure World Foundation. And this is submission 92 for the Data for Policy Conference. So in this presentation, I'm going to show our estimate that the use of satellite data in polio vaccination campaigns in Nigeria resulted in net socioeconomic benefits between 46 million and 153.9 million. And so throughout this presentation, I'm going to walk you through the process of how we determined this value and how that value came about. So I'll begin by talking a bit about polio vaccination efforts in general, and particularly explaining the role of understanding the size of the population and how satellite data can contribute. I'll talk about the importance of estimating the value of satellite data, why this matters to policymakers and others, and I will then give you our methodology for this Nigeria case study and some of the key data that we used. I'll talk about the socioeconomic costs and benefits associated with this case, give you some insight into our analysis, and then leave you with a few conclusions and takeaways. So in the 1980s, polio was spreading all over the world. It crippled an estimated 350,000 children per year, and it was actively spreading in 125 countries. In 1988, the World Health Assembly called for the eradication of this disease and began a campaign to do that all over the world. That was quite successful. By 2012, there were only 3 countries where wild polio virus continued to spread. Those 3 were Nigeria, Pakistan, and Afghanistan. And nearly half of all global cases at that time were in Nigeria. So it was a particular focus of this effort. So polio can be eradicated when a large enough proportion of the population is immunized. Scientists estimate this at about 80% of the population. So you need to have about 80% of people vaccinated in order to eradicate the disease. However, in order to estimate the number of vaccinations that you need to achieve that 80%, you need to know how large the population is to begin with. And you also need to know where that population is located. Normally, when we're going to estimate the size of a population, scientists will use estimates that are based on the census with some kind of percentage growth estimated for each year to account for growth that's happened since the last census. However, estimating the population can actually be quite challenging. So in Nigeria, for example, the last census was run in 2006, so 15 years ago. And we know that there's been significant growth since then, and that growth is variable in terms of where it's taken place and where the population is located. And this is where satellite data can come in and play a role. Excuse me. So I'm highlighting the work of a couple of different groups affiliated with the Bill and Melinda Gates Foundation and with others involved in this vaccination campaign effort that developed these new methods. So first, researchers developed a census-independent method of estimating the population using satellite data. They basically used satellite images of this area, looked at the different types of housing that were there, did some work on the ground to understand how many individuals tend to live in these different types of housing, and were able to make estimates based on that and then confirm them by doing some ground truthing. And so they came up with these estimates of the population based on the satellite imagery that showed that the population was actually much larger in the key northern areas of Nigeria than was being estimated based on the census. At the same time, there were also others using satellite data to create better maps. So in the vaccination campaigns prior to 2012, they were using just hand-drawn maps of these areas, created by people who were there. But sometimes these maps would not be quite geographically accurate, or they may have settlements that were completely missing from the maps. And so when they created these satellite maps, they were able to find those missing settlements and make sure that they were included. They were able to have kind of that map be tied to GPS coordinates, so you could actually track where the vaccinators were going and make sure that no places were missed. And so this improvement in the maps was also an important innovation that occurred at this time. And you can see the two papers that I've referenced here that are written by the individuals that were involved in that work and can give you more detail on exactly how they went about that. So they had these two satellite data-based innovations, interventions that took place. And then transmission of wild polio virus in Nigeria was interrupted in 2014. Now, I will note as a caveat, there were 4 cases that showed up in 2016. Those were in an area of the north that was having significant security issues that limited the ability to reach people for vaccination. They were able to deal with that issue. And then since that time, there have been no cases of wild polio virus in Nigeria. In any case, for our study, what we're interested in is looking at this work that took place and understanding, well, what was the value in dollars of the use of satellite data in these cases? Why is it important to understand the value of satellite data? This is particularly important for policymakers. So, for example, those at NASA that fund and operate these, expensive satellite programs, and they really want to understand what is the value of this satellite data, and how is it being used, and is it worth the investment that we put into these programs? And so this project that what I'm presenting on today was funded as part of a project between Resources for the Future and NASA called the Valuables Program that aims to do exactly this, to understand the value of satellite data in a number of different applications. Within the Valuables Program, most projects take a value of information approach, where the goal is to measure how satellite information benefits people and the environment when it's used to make decisions. And the way you go about this is by examining a counterfactual. So comparing the action that was taken if the satellite data is used, compared to the action that is taken if no satellite data is used in decision making. So in our particular study, we're, of course, looking at polio vaccination campaigns in Nigeria. And so we want to compare the decisions that would have been made, or the occurrences that would have happened if satellite data was used, if you're using a satellite estimate of the population, versus if you were making decisions without the satellite data, so using that census-based estimate of the population. And we base our analysis on the fact that you're going to have a difference in the likelihood of halting transmission, right? So I have a number of our key variables here, and you can kind of see them graphically on the right. First, you can remember from that earlier slide, you have a vaccination threshold. You need to meet 80% of the population being vaccinated in order to halt transmission of polio. You're then going to also have an actual level of vaccination, an actual proportion of the population that gets vaccinated. Of course, you're aiming to get 100% of the people vaccinated, but this often falls below that level. Then we have a population estimate that's based on satellite data and a population estimate that's based on census data. And then finally, we have the true population. Now, in our study, to represent the true population, we're using a probability distribution. So this is based on work that was done by the Grid 3 organization, using satellite data, but then also doing some work on the ground to verify that information. And so they were kind enough to provide us that actual probability distribution with their most up-to-date data. And you can see more details about that in the paper. And so we have this probability distribution that represents the true population in this area. And what you can kind of see on the chart here is if you are vaccinating a given proportion of people, assuming that your population is what the census-based estimate says, then your total number of people estimated is going to be relatively low compared to if you have the actual level of vaccination, proportion of vaccination that you're achieving times the satellite-based estimate of population, the mean estimate from the satellite, that's going to be a higher number of people or a higher proportion of people that are vaccinated. And so it's possible that even with this smaller number, the true population is sufficiently small that you're still going to achieve a halt in transmission, right? Which is going to occur with as long as the true population meets that 80% threshold. So that's represented by this X%, that area under the curve is halting transmission, even if you use the census-based estimate. And Y% is the likelihood of halting transmission if you're using this satellite-based estimate. And so recognizing that, satellite data is not giving you a perfect estimate, and also that even with the census-based estimate, you could potentially halt transmission, we want to use that to vary our socioeconomic benefit estimate to take account of this. So we have Y% minus X% is going to be kind of the added value that satellite provides. Okay, so here you can see some of the actual numbers for each of those variables that I talked about. And you can see the source of that information. And once again, a lot more detail in the paper. I will add, we have one extra variable I didn't talk about on the previous slide. And this is the population estimate that's based on essentially the hand-drawn maps. So after they created the satellite maps, researchers estimated that about 5% of the population was located in those missing settlements, the settlements that hadn't shown up on the hand-drawn maps. And since the hand-drawn maps were so key in guiding the process of these vaccination campaigns, we also wanted to have an estimate based on that. And so we look at a population that's sort of missing 5% of the true population. And then here, by putting together, those estimates of population together with the actual vaccination coverage, which is based on data from the Bill and Melinda Gates Foundation and that is collected after the fact to kind of test how well these campaigns did in terms of vaccination, then we get a probability of halting transmission of polio for each of these cases, right? For a satellite-based estimate, for a census-based estimate, for a hand-drawn based estimate. And so thinking back to that diagram and this, Y minus X amount, you're going to get somewhere between 30% and 91%, depending on your assumptions. So meaning that be somewhere between 30% and 91% of the socioeconomic benefits associated with halting transmission can be attributed to the intervention with satellite data. Okay, another quick caveat here. There is value of creating these more accurate maps that goes beyond just the estimate of population that I've been talking about. When you do vaccination campaigns, you're assuming both homogeneity and randomness. So you're saying that all individuals are equally likely to be vaccinated, and that failure to vaccinate is random, right? So the individual who's supposed to be vaccinated is out of town or maybe sick when the vaccinators visit, but it's just a random thing. When satellite data was used and they identified those missing populations, those were populations that were being systematically missed over and over. And if that had continued to happen, it's possible that you wouldn't have been able to halt transmission at all, because those individuals were not randomly being missed. It was an area where the virus could continue to occur and then be transmitted to other areas and kind of continue that cycle. And so by just focusing on the population estimate rather than this geographic element, we're probably giving it an underestimate of the value of satellite data. Okay, so now I want to walk through the net socioeconomic benefits. For our estimate of the benefits, we're just going to look at 1 year. So basically, we're making the assumption that by using satellite data, you halted transmission 1 year earlier than you would have otherwise. And if you hadn't used these satellite-based interventions, they would have come up with some other way, either having a much larger number of individuals working on this issue, or something else. They would have found a way to solve it in a year. that's a pretty optimistic assumption, I would say. And so this using 1 year of benefits is probably going to give us a conservative estimate of the total benefits. So the benefits come from savings from cost savings from vaccination campaigns that can be ramped down. They come from health benefits. And then we also want to take into account the cost of the satellite data and the analysis associated with that. Okay, so the vaccination campaign cost savings. These basically come about because vaccination campaigns are very expensive. You need personnel, you need the vaccinators on the ground, you need the community-based educators, you need expert technical assistance, you need a lot of infrastructure, you need to have transportation to get the vaccinators out there, communication, you need to have cold storage for the vaccines, and of course you need to purchase the vaccines themselves. So there's a lot of costs associated with running these vaccination campaigns. And based on the budgets that are available for the Global Polio Eradication Initiative, specifically for Nigeria, these were about $281.18 million in 2014. Then when you had the halt in transmission in 2014, that budget ramped down over time. And by 2020, it was about $110.3 million. Now we argue that that ramp down period is going to happen, regardless of when the transmission is halted. And by halting it a little bit earlier, what you're really trading off is one high cost year, like you had in 2014, where you're really having these full scale, lots of vaccination campaigns, because you're still trying to halt transmission. And you're trading that for a year like 2020, where you're just kind of keeping the status quo. You've already halted transmission and you're just trying to maintain that. And so we estimate the cost savings for 1 year of about $170.85 million. You also get, of course, health benefits. The first one we look at is the decline of polio in Nigeria. Now, this one, the benefit in some ways seems relatively small, right? Because as you approach the halt in transmission for wild polio, the number of cases goes down pretty significantly. And so in 2014, there were only 6 cases of wild polio virus in Nigeria. A couple of years earlier, there were 122. And so for the estimate of the benefit here, we look at that full range between 6 cases and 122 cases. In order to convert that into dollars and be able to put a net dollar value here, we use a number from the literature on polio that's pretty well accepted in that community. There are also polio cases that occur in other countries because of polio existing in an endemic country. So polio from Nigeria was exported, for example, in 2013 and 2014 to Somalia and Cameroon, and created 108 cases of polio in those communities that had previously halted the transmission of polio in their own countries. These types of breakthrough cases can vary significantly. There's a lot of factors, right, including what's in place in these other countries that affects them. And so we kind of give a rough estimate of about 50 cases that would have occurred if transmission wasn't halted. And again, use that same value from literature to convert that to dollars. Then we also, as I mentioned, want to take into account the costs of satellite data. This is, based on the funding that was put in mostly by the Bill and Melinda Gates Foundation in order to purchase satellite data, to do this original analysis, to do some ground truthing, all the work that was involved in being able to use this satellite data in the vaccination campaign. And the estimate of the cost for that is about $5.75 million. Okay, and so basically, on this chart, we just put it all together. So we have the cost savings, the health benefit value. We add those together to get a total benefit between 172.3 million to 175.5 million. We multiply that by the factor we calculated earlier, kind of decreasing the total benefit to recognize the fact that you may have gotten a halt in transmission even with that census-based estimate, and so we want to just give that marginal benefit that satellite data was providing. And then lastly, we want to subtract that cost. And when we do that, we get that number that I provided in the very beginning of the presentation, a net socioeconomic benefit associated with the use of satellite data between 46 million and 153.9 million. And as a few takeaways, I want to remind everyone this is likely an underestimate, right? We're looking at 1 year of benefit when it might potentially be more than that. Also, we're not taking into account a lot of other benefits that are very difficult to quantify. So, we estimated the number of polio cases that you would see and the cost in dollars of those cases. But of course, the cost of individuals having polio is much, much larger than what you can put on a dollar amount, right? That those are human beings, and that affects their lives, it affects their families, it affects their communities in a way that can't just be translated into dollars. And so we want to recognize that as well. Also, with the satellite data, it's not only addressing inaccuracies, right? Creating a more accurate estimate of population or a more accurate map of the area. It's also addressing inequities, that these populations and these settlements that tend to be missing from traditional maps that people aren't aware of, that are not getting these services, getting those groups back on the map plays an important role, and make sure that those individuals are getting the services that they should be getting, are included in community efforts. The ability to complete this effort and halt transmission more quickly and efficiently can also help to avoid vaccine hesitancy. So as these campaigns drag on, taking potentially many years to fully eradicate the disease or fully halt the transmission in one country, people get frustrated, that they have these individuals coming and vaccinating their kids over and over for this disease that they're really not personally seeing a lot of in the community. And that can lead people to distrust vaccines, distrust this process. Whereas if you can do this quickly and efficiently, it engenders more trust and more goodwill with the community. Another benefit that came from this effort is capacity building in local populations. So in particular, when they're creating these satellite-based GIS maps, they're training people on the ground to be able to use them, be able to work with them. And those individuals who are trained with that capability can go on and use that in other areas as well. And so the government of Nigeria is using these maps and these capabilities in other ways moving forward. The maps and this process are also being used not only for polio, but for things like measles, yellow fever, lots of other applications. And it's being used beyond Nigeria. So a whole new organization, Grid 3, was created to carry on this work. Grid 3 is doing really amazing work, partnering with other countries within Africa, looking at other applications, can be related to disease or vaccination, but also things like where to put health clinics, working with issues with COVID. So lots of really important work and benefits that came out of this original project. So just some final thoughts to leave you with. I hope that we have convinced you that there was a significant benefit that occurred from the use of satellite data in this case, that there are many other applications of satellite data that are possible. And we hope that this creates, further encouragement for the satellite data and global health communities to work together and develop these additional applications. Thank you very much for listening to our presentation. And if you have any questions at all, please do feel free to reach out to me. I'm Mariel Borowitz, and you can see my email there at Georgia Tech. Thank you.